What if I told you that there's a hidden toxin in your environment that could be making you very sick and your doctor doesn't even ask you about it? Today, I'm going to talk about mold and mycotoxins and how it's a silent trigger of many different chronic inflammatory conditions, yet most people don't even know about it and doctors don't even learn about it in school. If you want to learn more about mold and mycotoxins today, then keep watching. Hi, it's Dr. Micah Yu, board certified integrative rheumatologist and also autoimmune patient as well. Today, we're gonna be talking about mold and mycotoxins. It's really important that we talk about mold and mycotoxins today because it's making many people sick. And many patients are going to doctor and even seeing 5, 10, or 20 doctors without any solution. And patients are getting bounced around from different doctors because the doctor has no clue what's going on. The patient is suffering from nerve problems, joint pain, GI issues, brain fog, memory issues, fatigue, yet there is no solution for the patient or even a clue what's going on with the patient. And sometimes mold and mycotoxins is the exact root cause why patients are experiencing all these symptoms. So let's get one definition out of the way first. You must be asking, what are mycotoxins? Well, mycotoxins are metabolites of mold. Common mycotoxin producing molds include Aspergillus, Stachybotrys, Penicillium, and Fusarium. And the names of different mycotoxins include ochratoxin, zearalenone, gliotoxin, trichothecene, and there's many more, but those are some of the main ones out there. These mycotoxins are not just allergens. They're neurotoxic, they're immunosuppressive, and they're also highly inflammatory as well. And mold likes to thrive in damp environments, really high humidity locations. Also, they occur when there's water pipe leaks, and they also occur in the food as well. I'm sure you've seen moldy food yourself, or if you've experienced roof leaks in your home or broken pipes in your home that lead to dampness in the household. So all these different factors can lead to mold growth. And here's where things get interesting. Mold by itself can cause something called mycotoxin illness. And mycotoxin illness includes a variety of different symptoms. Patients can have brain fog, worsening memory, joint pain that's unexplained by doctors, GI issues with constipation or diarrhea, nerve issues with tingling and numbness down extremities that doctors can't explain. And these are just some of the symptoms of mycotoxin illness. And not only that, mold and mycotoxins can worsen chronic inflammatory conditions such as lupus, rheumatoid arthritis, multiple sclerosis, and many more conditions. Mold can be the underlying root cause of mast cell activation syndrome, chronic fatigue syndrome, fibromyalgia. In my own clinic, I dig and look for any signs of mycotoxins because sometimes patients say that they don't have any mold exposure that they can recall. Well, patients aren't exactly looking behind their drywall sometimes. So when we test it, sometimes patients have high levels of mold and mycotoxins in their body. Millions of people are struggling with joint pain, brain fog, fatigue, and other systemic symptoms. And they have no idea that mold could be the culprit. And let me remind you that this is an integrative medicine diagnosis. Regular doctors in allopathic medicine are not going to be asking about mold exposure. They probably haven't even heard of the term mycotoxins or even mycotoxin induced illness. So if you mention the word mold and mycotoxins to your doctor might just brush you off or ignore you completely because they have no idea what you're talking about. So why am I talking about mold and mycotoxin? It's because it is and can be the underlying root cause of your condition. Of course, there are other root causes out there, but this is one of the main ones that doctors aren't investigating and patients aren't even thinking about as well. So signs and symptoms of mold I've mentioned some already: brain fog, fatigue, memory issues. How about recurrent headaches? How about recurrent sinus issues, chronic sinusitis that doesn't go away? Or how about sleep issues? And IBS is another GI diagnosis that can have mold as an underlying root cause to the symptoms of diarrhea and constipation and abdominal pain. So I get concerned when I talk about these symptoms with my own patients, because a lot of patients are getting bounced from doctor to doctor and they're just getting pills for their symptoms and diagnoses without really getting to the root cause, which could be mold. So that leads me to my next point. How do we even treat mold and how do we diagnose it? Well, there's a couple of ways to test for mold. You can do a urine test and you can do a blood test. The test that you don't really want to do is an allergic test to mold, because that doesn't really tell me and other integrative doctors whether you have mycotoxins in your body. So don't get that IgE antibody test through your local lab. That doesn't really help. You want to get a mycotoxin test. So there's different companies out there. There's Vibrant America, Real Time Lab. There's also Mosaic Labs, and that used to be called Great Plains. And there's a blood test called MyMycoLab. Now, is there a perfect test out there? I would say no. Right now, the research in mold and mycotoxins is still evolving. So it does need to take time. As you can understand, Western medicine doesn't believe in mold and mycotoxins at all. So there isn't too much funding going into this. So it is something that is going to take time to evolve, but these are some of the tests that we have on the market today. I personally use Real Time Lab in my own patients. I get mentored in mold and mycotoxins from different gurus, you could say, or different experts in this field, such as Dr. Neil Nathan and Jill Krista, two of my mentors in this space that I learn from and I really look up to when we talk about mold and mycotoxins. And how do we test for mold in the home? Well, that's different than the mycotoxin test that we're doing on the body. So if you do have mycotoxins in your body, then it might be a good idea to also test for the home as well. There's something called a ERMI test, ERMI test. And the ERMI test is a test that you can just do at home. You can put little dishes around the home in different rooms to see what type of mold is growing in that area. And that's a cheaper way of doing this type of test. Of course, you can get an expert mold tester, a remediator to come out to your home to test for it as well. But you gotta be really, really careful when you get these mold inspectors to come out to your area, because these mold inspectors might have a financial incentive to tell you that there is mold so that they can charge you to remediate your home when in reality you may not really have mold. So an organization that I'm a part of is called isei.org. And this is an organization that I am very proud to be part of because we talk about mold, Lyme, and other environmental toxins out there that can cause patients medical problems. And this website does have a list of different mold inspectors that this organization has vetted. So these are just some of the ways to test for mycotoxins and mold in the environment. And you must be asking, great, now I know how to test for mycotoxins and mold, but where is the mycotoxins in our body? Well, the mycotoxins, well, most of it is situated in the bile. And when we eat food, bile goes into our intestines and our small intestine, and actually it gets reabsorbed back into our body. So if the mycotoxins are in the bile and bile gets reabsorbed, you're reabsorbing the mycotoxins. That's why it stays in the body. How do we get rid of the mycotoxins if it keeps getting recirculated in the body? Well, the treatment of mycotoxins is very, very complex, and it's very intricate and nuanced. And there's many steps to it, but I'll break it down for you here. One of the first steps to treating mycotoxins is to get rid of it out of the body, and that needs binders. And binders consist of charcoal, clay, chlorella, amongst other medications as well, such as cholestyramine and Welchol. You can mix and match a number of these different binders to try to get the mold out. Once the binders are in, then we move on to the next steps, which include antifungal treatments so that we can kill the mold off and the mycotoxins. And that can include itraconazole, fluconazole, amphotericin B. There's different types of antifungal treatments out there that need a prescription. That's pretty much the big picture of it, to bind and then to kill. Of course, not every single integrative doctor is gonna practice this way with mycotoxins and mold. Some integrative doctors and naturopathic doctors simply use binders. They don't use antifungal medications or treatment. Every practitioner has a different way of treating this. There's no guidelines for this, unfortunately. So a lot of us are learning on our own and learning from each other. So I'm part of groups out there in my email threads where I talk to different doctors and naturopathic doctors, where we learn off each other and put our brains together to treat many complex patients, such as the ones in my own clinic. Now, treatment can be sometimes very, very slow because some patients are very, very sensitive, where if I gave them some medication or supplements, they can react to it and develop even more brain fog, joint aches, and headaches. Sometimes patients are just not ready for treatment. I always tell my mold patients that treatment can be a year or longer because there are many steps along the way, and sometimes we need time for each step to kick in. And not everyone's gonna believe in mycotoxins, but it's out there in the scientific literature. If you type in the word mycotoxins in PubMed, there are over 50,000 results in the search. And if you type in mycotoxin illness in the search in the scientific literature, there's over 200 scientific articles out there on mycotoxin illness at this time, which isn't much. So it'll take some time for the medical community to eventually adapt to this diagnosis, and it might take decades. I want you to know that it's really important to think about mycotoxins and mold for chronic illnesses because it can be underlying root cause. And I just want to point out, there is one article from the Clinical Journal of Rheumatology back in 2003 that mentions damp environments contributing to joint pain and arthritis and rheumatic autoimmune diseases. I scoured and I looked all over the scientific literature for any proof that mold can contribute to rheumatic diseases, and there's only one out there, and it was very interesting. There are these employees at this healthcare building that was exposed to a high moisture environment, and they said that about half the employees got some rheumatic diseases, and some of them, when they left that environment, some of them did get better, but others still had persistent symptoms and the disease was still pretty active. It's possible that the abnormal symptoms that these patients were having was due to the underlying microbial growth of that structure. So the literature will be coming out in the future. So if you are experiencing mystery symptoms, going from doctor to doctor and not getting any explanation, or suffering from a chronic inflammatory condition such as lupus or rheumatoid arthritis, you have to think about, what is my underlying root cause? Could it be mycotoxins and mold? In my own clinic, I test for mycotoxins and mold, and I try to put a global picture to my patients to see what could be driving my patient's condition. If I never look for mycotoxins and mold, and if I never ask the right questions, I could be missing a big piece of the puzzle that can solve my patient's problems forever. This video was very important for me to get out to you because you're not gonna hear much about this out in the community, and you're never gonna hear this from your local doctor. I can guarantee you not many doctors will mention the word mycotoxins to a patient. So I hope this video really helps you. And I've been learning about mold for the past 2 years, and I've learned so much from my mentors and the integrated doctors that are really deep in this space. So have you experienced really strange symptoms that doctors can't figure out? I would love to hear from you, and please comment below about your experience with that. If this information is new to you and you've learned from this video, please hit the like button. And if you want to hear more about integrative health and ways to calm down inflammation, then please hit the subscribe button because I'm going to be talking about more videos just like this in the future. You can find me in person in Newport Beach, California, or you can find me virtually where I see patients all over the USA and all over the world as well. And you can simply go to drlifestyle.org. That's drlifestyle.org. And you can find this in my profile. See you guys next time.